People are turning to AI for just about everything, from writing emails to planning trips to now getting medical advice, something doctors don't exactly recommend.
If you're not using ChatGPT as your personal physician, you're missing out.
The whole asking Chat to act as my medicine doctor really helped me.
So how many people are doing this? A new survey from KFF finds about a third of adults use AI chatbots for health information, about the same number who turn to social media.
The increasing cost of healthcare and the increasing difficulty people are having trying to get appointments. I think we see that reflected in this urge to try and find quick information or another substitute.
Liz Hamill, KFF's senior vice president, says most people use AI for general questions like looking up a symptom, but some still rely on it to explain test results before hearing back from their doctors.
One of the things that I found really surprising is that a lot of people are using these tools and not following up with a doctor.
I am so busy, so I just don't have any time to go into the doctor's office.
My copay at the doctor, don't want to pay for that.
The trend highlights real gaps in our healthcare industry. According to the poll, younger people are more likely to use these tools along with Black and Hispanic adults and the uninsured. Using the internet to answer health questions isn't something new. WebMD, almost as old as the web itself, and we've all been there, going down the dark, scary hole of Dr. Google, convinced our symptoms add up to the worst-case scenario. In some ways, AI tools now are just making that process easier and smarter. That is, if the AI gets it right. A recent study published in Nature found ChatGPT Health missed more than half of emergency cases, like severe diabetes complications and respiratory failure. The chatbot also over-recommended care for about 65% of non-urgent cases. An OpenAI spokesperson says the study doesn't reflect how ChatGPT is typically used, saying it's built for follow-up questions, not a single response to a medical scenario. But with results like that, it might not be a surprise that doctors aren't thrilled with the emerging tech. Some states like New York, considering legislation that would ban AI chatbots from impersonating licensed professionals like doctors, lawyers, or vets. Proponents of AI have called it protectionism and bad for consumers. But even some doctors say physicians are now using AI chat tools themselves and recognize the benefits.
They are convenient, they're inexpensive, they're pretty smart, and they probably know more than the patient would know. But they can be hazardous if we're not careful. What I tell people is use them thoughtfully.
Dr. Robert Wachter, author of a new book about AI called Giant Leap, says it could all help transform the healthcare system.
Medicine has so many unmet needs, and I think unmeetable needs if we don't use AI, that I think the combination of the magic of the technology and what medicine needs to do is it's a very powerful combination.
A powerful combination, not a replacement. If you're concerned enough to ask AI, you should probably call a doctor. Dr. Akshay Syal, NBC News.
We thank you for watching, and remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.